Good evening, everyone. I'm Kamal Narayan, CEO of Integrated Health and Wellbeing Council, India's premier institution for health awareness, advocacy, and behavior change. And it gives me immense pleasure to all of you to this very significant discussion on women and NCDs, from awareness to action, presented by IHW Council under its Sapath 1000 Days initiative and in collaboration with Artist For Her. When we talk about health, non-communicable diseases exert enormous pressure on health systems and are a major challenge for public health. They not only impact the physical and mental well-being of individuals, but also inflict harm on socio-economic development of a nation. According to World Health Organization, more than 70% deaths are attributed to different NCDs, including cancer, stroke, hypertension, diabetes, and cardiovascular diseases. In India, we look at the numbers. 1 out of every 4 Indians is at the risk of dying from some kind of NCD or non-communicable disease. When it comes to women's health and NCDs, it is disappointing to note that they constitute the higher burden. Owing to social factors as well as gender disparity, the health of the women is often under-prioritized, and hence it is no secret that women find themselves at the receiving end as far as the family health is concerned. Pregnancy, motherhood, and other concerns related to reproductive cycle and health further make women prone to health issues, which at later stage in life may result in chronic conditions, including cervical cancer, breast cancer, or many others. Women in developing countries like India are victims of worse deprivation as a consequence of poor empowerment and discriminatory beliefs and practices. Hence, awareness creation at all levels is the most important and basic step in empowering women. Creating relevant knowledge on the detection and early diagnosis of major NCDs should also be done at a mass level, and also information on lifestyle changes, including a physical lifestyle and a good nutrition diet, is also imperative to make sure that women prioritize their health over family responsibilities. There is an urgent need to address these gaps in women's health in our country, and apart from awareness creation, infrastructural challenges also need to be addressed in a holistic manner so that early diagnosis can help in successfully bringing down the mortality rate as well as in helping preventing many of these disorders. We are firm believers that a nation's and a society's health and well-being are dependent on the health of the women, who are the harbinger and facilitator of good health and environment for their families and societies. Therefore, women's empowerment and equal access to good health control the key and is an important priority for any country. The massive awareness and advocacy programs that IHW Council and Artist For Her conducted under its mission Sapath 1000 Days have already created a substantial impact, and we are sure that by expanding our horizon to cover the challenges being posed by NCDs, it will further go a long way in bringing all stakeholders on a common platform, as well as changing society's mindset towards good health and preventive health care for women. And with this hope, let's move on with our today's very special session, and let me invite and introduce the moderator, the host of this session, Dr. Hema Divakar, founder and CEO of Asian Research and Training Institute for Skill Transfer, which is called Artist For Her, and also the chair of FOGSI Committee on NCDs. Dr. Hema Divakar is also the medical director for Divakar's Specialty Hospital in Bangalore. So over to you, Dr. Hema Divakar. Welcome to this program, and also we would like to put forward our heartfelt gratitude for you to take up this leadership, this responsibility to address the growing burden of NCDs among women, and also coming forward to bring all stakeholders together to deal with this challenge. Thank you so much, Dr. Hema Divakar. Over to you.
Namaskar. Thank you, Kamalji. And right at the outset, I must also congratulate the IHW Council for consistently and persistently being at it. The Lage Raho principle, if I may call it, because many things which need to be done require us to be working on it again and again and again till we create an impact. And Shapath 1000 is one such initiative that we will continue our journey and have the young leaders, as in today's program, lead the way towards wellness in this great country. Today we have with us Sanjeev ji, who has been a constant source of support, and he is a great link between the public and the private, with the great lot of experience and maturity that he has in dealing with the health systems as such, and insight into how to make things happen. Well, from our own parent organization, FOGSI, we have many leaders in the making and leaders in their own merit. We very fondly welcome Dr. Surekha Taide, who is the chairperson of the Clinical Research Committee. Data on the table is her responsibility. There is Dr. Priya Ganesh Kumar, who is the chairperson of the Gynecological Oncology Committee, and everybody in the country and beyond knows the scare that the cancers or the malignancies can bring in. Dr. Charmila Avayu is the medical director of the Aditi Hospital and the vice president-elect of FOGSI, and she's held several posts and projects very well executed and has a brilliant tenure in the past and looking forward to much more in the future. Dr. Vidya Tobbe, who's the chairperson of the Food and Drugs and Medical Legal Equipment Committee of FOGSI, hails from Vijaypur, originally called as Bijapur, and is the in the Institute of Al-Amin Medical College, and going to be stepping into a prestigious post of the president of the All Karnataka Obstetrics and Gynecological Society. Last but not the least, Dr. Priyankur Roy, who is the youth icon of FOGSI and the chairperson of the Public Awareness Committee of our organization, and spearheads the Connect and Collaborate initiatives right across India, though he's sitting in the Siliguri, which is a very beautiful part of our country. So with that, I would ask the first round of questions and then let Kamalji step in with the head of our organization, FOGSI, the president, Dr. Rishikesh Pai, who has had a dialogue with Dr. Kamal Narayan, the CEO of IHW Council, to place his vision and mission towards NCD awareness to action. So my first question goes to Dr. Priya Ganesh Kumar. As the title reads, many are not even aware of the expansion of NCDs, non-communicable diseases. To the lay delegates who are attending this program, communicable means if I have the disease and I am in contact with you, I can communicate the disease to you. Whereas non-communicable, as in if I have a cancer, from me, it does not pass on to you just by being in close vicinity to me. So out of the bracket of NCDs, the oncology committee, which you're leading, Priya, especially with a focus on the cervical cancer, which is the second leading cause of death of women in this country. Many, many deaths which could have been prevented. And the WHO is toying with the idea, the buzzword being 90, 70, 90. Can Priya explain what are these numbers all about? And the first response from you will, of course, create the awareness of what this means. And then I would also want you to follow up with what are your action points to make a difference to the snowballing numbers of cervical cancers in this country. Priya.
Thank you, madam. Thank you, Hema, madam, and the team to invite me. for this prestigious, webinar and a prestigious platform for the public to understand what NCD is and what are the relevance, as you rightly said, because it is a non-communicable disease. And in our country, and why in our country only? In the globe, when you talk about cancer, the word is very obnoxious and people do not want to talk about it, leave apart, even check for it. So what we and the most sad part is India is leading the globe next to China for the cervical cancer deaths and the incidences.
Yeah.
And also, one lady is losing her life every 8 minutes in our country for cervical cancer. And also, the rates have really, if you see the maternal mortality rate, MMR has fallen down, but cancer rates are still at the top. And the best part is it is preventable. So WHO came up with a fantastic slogan. The first of all, the motto of this slogan was "World Free of Cervical Cancer." That's a cancer elimination drive. Cervical cancer elimination drive by 2030. So how do you achieve that? And what is an elimination drive? An elimination drive is less than 4 per 100,000 women in any set of population would be suffering from cervical cancer. So when you talk about a elimination drive, there has to be certain. Now, what is India? Where is India? Now, India is having 18 per 100,000 women being. So we have, if we have to, today we are at 2023. And if we have to actually follow up in 2030 to have a complete elimination, we then, the strategy laid by WHO was 90-70-90. That is, knowing the fact that cervical cancer is caused because of an infection called as human papilloma virus. So everything rooted around it, thinking that like there is a virus, there is a vaccine available for prevention. So 90% of the girls from the age of 19 to 14 being vaccinated with an HPV vaccine, 9 to 14 years, being vaccinated with 2 doses, 6 months apart, with the HPV vaccination. Right. Now we do have various types of vaccination. Now, luckily in India, now we are going to have, is already launched the Sarva vaccine, which is again a quadrivalent vaccine. So this has to be now. It's the people who have not taken this age has passed off. So there is a catch-up vaccination also, which can be taken by the adult girls. It can be, for FOGSI recommends, can be taken till 45 years with 3 doses apart. All right. So that was the primary prevention. Now the secondary prevention comes is vaccination per se. That's a primary prevention, but screening has to go hand in hand with the vaccination. So what is the screening about? Any lady who is actually, screening goes for a symptomless, apparently symptomless, ladies should be getting themselves screened, like how we screen for diabetes. So we come to know, oh, we are diabetic. Or we screen for our hypertension, we come to know we are hypertensive. Similarly, since the cancer has a preceding age of 10 to 15 years, where there is the cells are getting little diversified towards that area. There are dysplastics, but they're not cancers. So we do have the pre-cancerous conditions, which is almost 99% symptomless. So lady has it, she doesn't know. She has never visited a doctor, so she doesn't know that she's suffering from precancerous conditions. Right. Now, so if the 70% of the target population, the populations above 30 years actually goes for screening. Now, in our country where the age of marriage might be, rural places can be little, very early. Or 20. Early sexual activities. So from 25 onwards, we recommend pap test every 3 years. And once they go with 30 years, then the screening goes with the HPV test. It's a simple test where you just take a brush and, take the sample. Nowadays, self-collection kits are also available. And they test for the virus itself. And if there are screen positives, then they go for treatment. So the 70% coverage would be for screening. And WHO goes a step ahead, stating that even if you screen twice in a lifetime, at 35 years and 45 years, with a high performance HPV test, so for the risk stratification, it's a fantastic module. And then whoever are screen positives, So 90% out of that, if they are diagnosed and treated by some colposcopies there, biopsies can be taken for the precancerous condition, and you treat them. Now, treating a precancerous condition is an OPD-based procedure, does not require anesthesia, general anesthesia. They just come in. There are those ablative treatments, excisional treatments, and fantastic. And if also the 90% of the patients, like while screening, you might find a cancer, full-blown cancer also.
Okay.
So they are also treated. So in that way, 90, 70, 90, if it is followed up in a proper way, we may be able to achieve that elimination.
Excellent. So, dear friends, we are talking about cervical cancer, which is the second leading cause, as I said. The first 90 out of the 90, 70, 90 is for vaccination. So, all in girls, be on the alert, avail of the vaccine. It is easily available in the country. Your doctor would give it to you in 2 doses if you're between 9 and 15, and 3 doses as a catch-up between 15 and 45. The 70 is everybody gets a screening, which means you can detect the cancer early. The last of the 90 is, well, if you're unfortunate enough and you do have the diagnosis of cancer, then if 90% of them are treated, that means, Priya, you mean to say if we really can get into action and make the 90, 70, 90 happen, then HPV infections and cervical cancer and deaths due to cervical cancer will be a thing of the past. Would that?
Absolutely. And 90% also is for the precancerous conditions, not only cancer. We do not want our ladies to go into cancer. We want to detect it at the very earliest precancerous levels and treat it easily.
So let's hope that this dream becomes a reality. So what are your action points within the country? First, you give us a sense of 90 is what we want to achieve in vaccine. How much have we achieved? How much have we achieved as of now? 70% had to be screened, and what percentage are screened? And 90 out of that precancerous had to be treated. Where are we, realistically speaking?
So realistically,
2033, March 15th. Where are we?
So realistically, we had actually conducted a survey. Okay, a survey from my committee that was called as SSNPP Drive, which you're aware of. And we named it so beautifully that we didn't wanted any cancer to be named as cancer, So we made it as Swastha Sundar Nari, prevent the preventable. All right. In this part, the first part was running a campaign and trying to understand the actuality of the ground level for vaccination and how many girls have been vaccinated, or, what is the awareness in the public for vaccination. So the awareness in the public for the vaccination and how many would have actually also vaccinated. So it was around 25 to 30%.
So 30 or 90.
Then comes the 70% part. 70% part, it was very much, disgusting to understand that, many of the ladies, only 7% to 10% had gone for screening. And, the reason why, huge gap.
So a lot of work.
And the urban population, ladies did have a...
Priya, you muted. Priya? I think
it was around 18 to 20%. So this was the actual statistics. Then what we did was we played AV videos. We have made audio, video, AV, this thing, IEC materials. And we played this, which gives information about vaccination, gives information about screening technologies, treatment. This is there in the FOGSI website as well. So we made it in 8 different languages, ran it through the same people, and around 4,000 ladies had taken active part, with 70 gynecologists pan-India taking this project sort of, making. So the data was very much compiled, and then it was a reversal. So when they came to know about it, and they came to know that it is so easy, the proportion of 90%, which was around 9 to 10%, now they gave all the right answers, and it rose from that to around 45% to 50%. So the gap was, awareness. And then the 70% from aware, that the 70% of screening population was actually somewhere dismissed from 9% to 18%. That rose immediately to 85%, and people really enrolled themselves and got themselves screened. So my
Excellent.
point of submission out over here, and I'm
Mhm.
reiterating this point time and again, that there has to be a proper awareness system being built up.
Yeah.
And this IEC material has been brought for the Foxians, to play in the lobby,
Yeah.
as a counseling, and really helps. So that was one part. And further from there, we started understanding where is the capacity building for our doctors.
Right. So
So
the supply side should also be robust. So thank you so
absolutely.
much, Priya. Priya is joining us all the way from Dhaka, where she's attending another very important meeting on gynecological oncology. And the Shapath initiative with all our leaders says we take a resolve, the Shapath, that we will all join hands in making the 90% vaccination, 70% screening, and 90% precancerous lesions treated a reality. And beyond 2030, when we meet again, from awareness to action, the scenario should be very much changed, because a simple initiative of building awareness, making them understand that their health is in their hands, has instantly changed the scenario. So we wish you all the best, and we promise that we will join hands. Thank you so much, Priya.
Thank you, madam. I take your
I'll,
leave. Thank you.
I'll now
Thank you.
switch to Dr. Charmila. Awareness is what we're talking about. We have a sea of women in pregnancy, 3 to 5 million every year with diabetes in pregnancy. We somehow manage to get the mother and baby intact and well when the time that they deliver. But after that, nobody looks at the mother for a long, long time. And this young lady who has had a high sugar in her pregnancy, just 2 to 5 years later, becomes a full-blown diabetic. For this, we had urged the government that awareness should be built. And 10th of March, the month of March is really an awareness, drive. We have managed to get it declared as the National GDM Awareness Day, so that everybody is aware. And this whole initiative was born out of south of India, the state of Tamil Nadu, where you belong. So can you just tell us your own journey about 10 years back, how girl and women used to respond to this? It was quite a shock to them that in pregnancy they have diabetes, and they thought it was short term, short lived, and then happily ever after. So how does this awareness about diabetes to action on testing them in pregnancy and following them up forever and ever to catch them at the earliest point in time where they're likely to develop diabetes? How has this had an impact on the health of the girls and women in the last decade or so? Charmila.
Thank you so much, ma'am, for giving me this opportunity. As you said, I could hear what Priya was talking was all about awareness, awareness, awareness. But that awareness is the way we are lacking. That's what I feel, because all the systems have come into place. The government is helping. The health providers now aware that diabetes is a great problem now for both the mother and the baby. But still, somehow it is not passed down into the general population. 10 years back, most of us, I think, even the gynecologists, were not so aware about this condition. We had like out of 100 patients, probably 3 to 4, and they will, as you said, they will just get away with that pregnancy, and the baby will be born, and then it will usually be a cesarean. They'll be worried only about the cesarean part. You will not worry about anything else. You call them for a testing again. Most of them don't turn up. And then you are also not so bothered, thinking like she had only gestational diabetes. What is it going to do? But now, 10 years later, we are seeing the repercussions of what we didn't do for those mothers earlier. That we are seeing now. These mothers have turned out to be full-blown diabetics now. And still, the awareness is not, I don't think it is spread to them yet. And we did a survey of rural women also, because we conduct camps for self-help group women who are below the poverty line near Trichy. So we conducted a health camp, and then we wanted to know like how their health condition is before we conducted the talk shows and all that. So when we did, we were very surprised. Women were supposed to be so active and supposed to be eating very healthy food in the rural area. they almost like 30 to 40% are diabetics, and they are not diagnosed yet. And when we went back into the food habits, it was like everything instant food now. It was not like before. Before going into the fields, they were not cooking at home, and they were cooking at home and eating, and they'll eat twice a day. So and they used to have all the local vegetables and fruits, and that seemed to actually help their diet and working pattern also. But now it's like they go to the nearby mess or something, take some food, or in the middle of the work they take from the local petty shop some of the sweets or whatever it is available, and that is the main diet now. And they're not even realizing that they're all thinking that that they're working so hard, and so they will not land up with these type of problems. And when we tell them that their body aches and the pain and all is all because they've got an underlying condition which they have not diagnosed yet.
Right.
So it is not only the urban population, the rural women are also suffering, and we are seeing the babies, the children which are like either growth restricted or they are macrosomic. They are the extremes in these women when they are born the second time. The first time they have got away with a healthy baby probably, but we don't know how the baby is going to fare 20 years later. But these women, when they come for the second deliveries, we can see that the babies are either growth restricted or they are macrosomic. Either of that extreme spectrums they are there. And the awareness, when you try to tell them, it is so difficult to put it into their minds. And their husbands also tell us she doesn't eat anything, and she hardly has any food, and still you're talking like she's a diabetic. I will not accept, because I think he needs to go home and have a happy atmosphere at home. So he's not accepting that his wife eats snacks in the middle, he gets food from the break. They don't accept it. Also, the awareness, we have to be very vigilant, and you have to keep on impressing on them. Otherwise, they think they are leading a very healthy life, and that is somehow going to translate into a very healthy pregnancy and a future also. But now we are putting up the data of that women who delivered earlier and the complications which they are facing now. And probably that will drive a point across that we need to be more vigilant in managing these women.
Yes, Charmila, because on one hand, it's a sensitive issue. On the other hand, now they have grown so insensitive. Diabetes to sabko hota hai. It's very common in our family, doctor. They're very cool and casual about it. What Priya mentioned was strengthening the supply side. Do you think in the leadership position in FOGSI, with all the capacity building programs that we are doing, inclusive of Manyata, which is, ensuring safe delivery by robust antenatal care and intrapartum care, do you think that there is some bit of a change in delivering the right kind of tests and detecting with the universal testing and not missing a case of diabetes in pregnancy, because that gives you an opportunity to have a handle on her for the rest of her life? It's a subset of women who are in a way lucky, because it's like an early diagnosis. They potentially can become type 2. So all the time, if they're vigilant about their lifestyle and somebody like us are monitoring them, hopefully we will have less and less numbers. What is your take on the role of the frontline healthcare providers, the clinicians, the supply side on this issue?
Manyata has created a great impact, I would say, madam, because it's a training point for the paramedical workers, which was never done for the private sector. So these nurses, they all know only the managing of the vitals, pulse and BP only they will check. They will not even know what to do. So when Manyata was done in Tamil Nadu and we were able to train our nurses on the blood sugar testing, I think it's taken on in a big way, because the patient will not talk to us much. They will feel inhibited in talking to a consultant for 1 or 2 minutes, but they are most of the time talking to the staff nurses outside the cabin. So when they talk to these nurses and when they drive the point across that they need to test themselves, take the food properly, the diet pattern, and how it affects themselves and the baby, they take the point much better when a nurse talks to them compared to what we talk to them, because they think we have got some hidden agenda somewhere. That's what the thinking is in many of the patients now. But they are very free with the paramedical. So, and Manyata has created a great impact. I would say it was one of the best initiatives which has been brought into the private sector of Tamil Nadu, because I can say from my hospital, I've taken classes for them so many times. They've never listened to me, but through Manyata, they've listened. And when the assessment was done, they were so enthusiastic, and they can rattle out the DIPSI testing in every language possible, like fast, everybody talks about it, and they make sure that and when we tell them like you wait for 2 hours for testing and all, the patient is quite she's not so happy sitting in the hospital for 2 hours. But when these nurses say like it's nothing, it will be helping you and all that, they listen much better. So I think Manyata is one of the best initiatives which is there for as far as diabetes is concerned, because and for the deliveries also, I would like to thank you, madam, because eclampsia management, PPH management, it's all like they are like more proficient than me in managing. That day they delivered and they managed PPH by the time I could come also. So it's such a great initiative.
Yeah, thank you, Chandra. One last question before I let you go. How has your experience been in getting these women back for testing in the non-pregnant state? Today, you've tested her, she's pregnant, she listens to everything that you say, but then once she delivers and goes home, you want her back in 6 weeks, you want her back next year, you want her back year after year, but she feels well, she doesn't feel the need to come to you. Has there been a shift in that postpartum care?
Yes, ma'am, because in Tamil we say the talamai is very mukyam. The top person has to be very vigilant about these things. You cannot let go saying that you have delivered and she's not my responsibility now. So we counsel them so clearly about all the repercussions which is going to happen to them and the baby when it's going to become bigger. And at 6 weeks, we give them a phone call and make sure that they come back, test themselves, and then we let them to go on to a physician if it's very high. Otherwise, we tell the diet and exercise and all about like how they can maintain themselves by self-monitoring also. So that initiative, I think I've learned through Manyata also. So that counseling part, we are doing it like for all our patients and calling them back for a testing. And most of them are quite, when you tell that the baby is going to be having a problem, they listen. They will not listen for themselves. But when you say that the baby is going to be affected, they come back always.
Excellent. Sharmila is one of our outstanding examples of saying where there's a will, there is a way. Otherwise, there are only excuses. Because Sharmila never makes any excuses. She puts all her might into whatever needs to be done and sees to it that it is done. So thank you so much for being such a great champion, Sharmila.
It's all your mentorship, ma'am.
Thank you so much. Now, the much awaited response from Sanjeev ji. Sanjeev has been our very distinguished speaker on the forum of IHW for years, and it has been such a sheer delight meeting him virtually and listening to him about all the inputs. Sanjeev ji, during your journey through the entire health systems in the last 2 decades, are you seeing any kind of change in the awareness? Are people more enthusiastic and receptive to get some inputs, especially because the WhatsApp universities flourished during COVID times, and also preventive healthcare? Has that gone into their heads now is what I wanted to tap from you.
Thank you, Dr. Hema Divakar. It's always a pleasure to interact with you, and we have interacted very often in the past. So before I start, I want to thank Kamal Narayan and his team of Integrated Health and Wellbeing Council for taking up this initiative and specifically asking for women and NCD.
Yeah.
We normally talk of NCDs, but women never get talked about when we talk of NCD. Thanks. And it's also a pleasure to reconnect with the senior officials, policymakers of FOGSI. And I was recalling my interaction with FOGSI started in 1980s and 90s. And Dr. D.K. Tank, the then president of FOGSI, became president of the International Body of Obstetric Gynecology Society. And extensive work FOGSI is doing in the field of improving maternal health. Coming to the question you have asked, Hemaji. Yes, there is a lot more information available today. An average person who interacts with doctor has already done some homework. Either he or she himself or herself has done the homework, or somebody in the family has done homework and conveyed it to her. But unfortunately, as you said, WhatsApp University is not really authentic information. And during COVID time, I wrote an article, Infodemic is converting public into COVIDiots. I'm sorry for using that word, but there's a lot more wrong information, and wrong information goes viral and the right information doesn't get well. Yes, awareness in the public has increased, but there are a few points I will like to emphasize. We need to be more aware.
Right.
One is the lifespan has increased substantially. 1947, average lifespan was 32 years. Today, it is 70 plus years. And the lifespan of women has overtaken the lifespan of men, and it started happening in mid-80s. And now women live on an average 3 years longer than men in India. It has implications for non-communicable diseases, because longer you live, more is the probability of your suffering from non-communicable diseases. So more than doubled life expectancy, and more so in women, you have to be more careful about non-communicable diseases.
Right.
And you rightly started your discussion with Dr. Priya Kumar. And these 90, 70, 90 is actually starting with people before they have the disease.
Yeah.
You know, your first objective is to keep those who do not have cancer, who do not have hypertension, who do not have diabetes, who do not have depression, keep them healthy.
Yes.
So that is your first objective. Unfortunately, most of us, if we are clinicians, we deal with this population. We have to reach out to school children, we have to reach out to workplaces, we have to reach out to universities, so that people are more aware. And if I will take half a minute, there are people drowning in the river. And we are trying to take them out, resuscitate them, bring them back to life. We can't resuscitate all of them. Some of them die, some of them have residual effects. You have to go upstream and see who the hell is pushing them in the river, in the water, drowning them. Stop them.
Yes.
That is the approach. Otherwise, you will keep opening hospital, keep doing treatment for cancers, for hypertension, diabetes. You have to focus on prevention. And one aspect which was raised very well in your 70 and 90, the last 70 and 90 of the approach to carcinoma cervix, pick them up early. Most of the cancers in India, more than half, are picked up when they have already spread beyond the local lesion. Yeah. And Dr. Priya Kumar precisely mentioned, pick them up not only when they become early cancer, pick them up when they are precancerous, because they can be cured. And the person who has been cured or has been prevented from going to advanced stage of cancer is again a candidate for other cancers. So your work doesn't stop here.
Yes.
And the last point I want to emphasize is, we normally talk about non-communicable diseases, communicable diseases, and maternal child health. These are not silos. We saw in COVID time, lot of people with NCDs died of infection. Yeah. And nobody stops from a diabetic mother from becoming pregnant. And a pregnant mother who was not a diabetic gets gestational diabetes. She is more like, she needs to be controlled for gestational diabetes during pregnancy, and she is more likely to become diabetic later on. Yes. So these are all interacting. So you cannot work in silos. Yes, for teaching, we talk about different silos, but in real life, these silos overlap and they interact with each other. So I will stop here now and then maybe come in when you have anything else for me.
Excellent. You know, the integrated approach, Dr. Pai, who is the president of FOGSI, has also brought in a terminology called Ekikaran. You know, just get everything integrated, don't split and work in your own verticals. And when a adolescent girl especially is available to you, comprehensively guide her for overall preventive care. Now that I can swing to Dr. Surekha Taide, it is all about numbers. And sometimes it's a perception, sometimes it's a reality, but we don't know enough, because when we say millions of diabetics, there may be a couple of million more who are undiagnosed in the population and lost to the healthcare system as if it were. And even a simple thing, I remember in one of the meetings with the government, we wanted not only the IFA or iron folic acid supplements to our pregnant women. We said, no, we in private practice give the calcium. We need the government to supply the calcium. And the next round of discussion was, how much calcium does an Indian woman take in her diet? And then everybody were looking at each other because there was no data on that. They said, oh, if she's already taking something, what is the dosage that we should give? What impact it will have? And should we do this? Should we do that? So the discussion went round in circles and kind of stopped there. And somehow in the third, fourth round, we managed to convince that we need that supplement. So who gets the data to the table? Who gets the robust data to the table? And the government data is in the public hospitals where 60% of the care is in private. So what are the initiatives by FOGSI, which has a couple of times initiated the eclampsia registry, for example, or PCOS registry, cervical cancer registry. Most of these have actually failed to make any impact on getting the real numbers on the table. So as the chair of the clinical research team, what are your thoughts about how to create awareness between the clinicians that this data is really so important, and how to get into action so that this data is fed somewhere? Because where to invest, what are the trends, how to get the policies moving where it can make a impact with the efforts that the group takes. So your thoughts, Surekha?
Yeah, thank you very much. And at the outset, I would like to thank IHW Council and FOGSI and yourself, Dr. Hema, for initiating this beautiful, initiative, I think, regarding women and NCW. So that's important, the focus on women, first of all, that's very important. And the focus on data also is very, very important. And as the chairperson of Clinical Research Committee of FOGSI, I would like to reiterate that we are lacking, in the data, especially we are talking of Indian women. The data is very, very scarce, and whatever we are looking at, the global data and whatever we are looking at, the data from LMICs are coming up now. But when we talk of local data, if you want to know how many women of, our country are suffering from hypertension, how many of them are suffering from diabetes, then there is one more thing, like mental health. How many of them are having depression? They're suffering from depression. Nobody, none of us who are sitting here, who are working for women for so long, for so many years, we don't even concern ourselves with hypertension and, diabetes. As far as, we are concerned, we know about hypertension disorders of pregnancy, we know about gestational diabetes, but our women later on in their life, they are suffering from hypertension. They are our own concern. They should be, and that is why I think FOGSI has come up with this really beautiful, they have come up with NCDs as an initiative this year. The focus is all on NCDs. And I must say that Dr. Pai's initiative of Badlav, and the Nari Swasthya Janandolan Yatra, 21 cities they has traversed in northern India, and they had a focus on collecting data. And I'm fortunate to have access to the data, and I'm fortunate to, be able to analyze that data also. We had data from around 4,000 women, may not be enough, but we do have a data which tells us that obesity is so very common, even in rural women. So we are talking of women, and they are very, very, obesity is quite common. In fact, in the data we found that 40% of women were obese, which is very high, which is very high. And central obesity, because we also looked at the waist hip ratio. So central obesity, even in rural women, the obesity was quite high. Then many of the women, of course, anemia testing was done in that. The anemia, moderate anemia was so huge, at the level of 50 to 60%, even now, in spite of all the initiatives taken from the government. Then apart from that, what was looked at was hypertension. Many of the women, there were 14% of the women out of 4,000, 14% were hypertensive, and they did not even know that they were hypertensive. And that means they were suffering for the disease for such a long period of time. Apart from that, blood sugar was done for these patients, and 9% women had high blood pressure. So
High blood sugar.
High blood sugar. So that means you have gestational diabetes women who are not coming back to you for treatment or screening for measurement of their blood sugar. They don't even know, and for years together they are suffering for them disease, and then finally they are landing into cardiovascular disease, which is killing so many women. So initially it was thought that the non-communicable disease all belong to the affluent class, but it is not so. 3/4 of these, NCDs are coming from the lower middle income countries, and especially women are at risk because there is also a gendered bias, because
very important point.
Yeah, because women are facing so many other things. One is lack of social problems, lack of education is there, poverty is there, women are suffering from access to healthcare is not there, it's not affordable. So many things are there, because of which the NCDs are becoming more common. And I think now these 4,000 data which we have, we need to escalate, we need to create a registry of sort of NCDs, and maybe we should look at the subgroup populations also, what kind of food they are eating, which area, which subpopulation, state-wise analysis probably will tell us where we stand and where our resources need to be diverted, which population we need to really address when we are talking of awareness. And definitely we need to talk of advocacy. We need to, from these kind of forums, we need to talk about advocacy, so that policies and programs are built in such a way that there is a gendered lens to it. They have to be refined, they have to be strengthened in such a way that women, they become the focus. Because if you look at all the NCDs, half the population suffering from NCDs is women, and they are underprivileged because of many things, as I have said, social problem. They are not able to access the care, they don't have decision-making power. So even if they want to reach a hospital, they are not able to. There may be problem of financial constraints. If you look at so many things are there. So you
actually, Surekha, from what you have said, two important points what I want to pick up is, one is that it's such a missed opportunity, isn't it? Because we in women's healthcare space seriously are not often bothered about their hypertension, diabetes, etc., because we think it is not belonging to our, so like Sanjeev ji said, break the silos and pay attention to that, because women come to us first, trusting us for their overall well-being. That's what we should do. And then, though the 4,000 data seems to be, it's a massive data in itself, but it is small for such a big country. But at least it is showing us the trends that obesity is real. The problem is existing. Anemia is still sticking there like a sore thumb, 50-60%, and we are not being able to get a handle on it. Now, my last question to you, Surekha, is what has been your experience? We say 40,000 gynecologists in FOGSI, but when it comes to robust data collection, guys, put your data into the register. Give us what is the trend in your practice, and then we have very little coming forth from them. So how are you going to change the mindset of the clinicians, making them recognize that it's so important for their contribution towards the data that we need to build?
I think we have a huge force with us when you talk of 40,000 gynecologists and women coming to them for treatment. Women are going to go to the gynecologist first. So first of all, we need to train our own people that yes, data collection is so very important. Putting things on paper and collecting the data is so, we were never taught in our residency. I think that's the problem. We always thought yes, research, when we say, oh, the eyebrows were raised, that's not for me, and we do have such a lot of existing data with us, but that is not getting collated, first of all. And so we need to train. And I think the trend has started now. People, because we are having easy information collection systems. Like if you have a Google form, you create a Google survey, and you have systems with us, tools with us, which can easily be able to. But let me tell you that when you collect data, it doesn't have to be very complex. It has to be goal oriented. What do you want to find, and how you're going to transform or translate the data into action? So that action points we need to first outline, and then find out, okay, I will collect only these 10 points. Because when you ask somebody to fill a Google form, it has to be in such a way that the comprehensive, only that data which is important you need to fill up. So these tools we should start using, a monkey survey or a Google form, which analyzes and tells us immediately, okay, this is the problem and this has to be addressed. If we say less than 1% of the population has taken the HPV vaccine. In the Pratibandh survey, which we conducted on the Cancer Day in February, less than 1% of the population had taken the HPV vaccine. So that's the point, So we need to work on it. Only 9% of women had taken done the pap smears. So that means we still have to work on the pap smears and still have to work on the cancer screening. And then we say 9% of the women are hypertensive and they didn't know. That means we need to conduct, awareness. We need to, go for primary screening in the community and go and take that blood pressure and do the simple blood sugar of the women and screen them out. So these are, so data points have to be, we need to create the surveys in such a way that it is easy to fill in, and the data can be analyzed, and quickly we can work and create some action points. That's very important.
Thank you, Surekha. It is S for Surekha, and it's also S for sensitizing our FOGSI community, S for smart and simple survey forms. And I think we are getting somewhere with this thought process aligned, and I do hope that we get hardcore data onto the table, not in a very research rich or scientific way, but at least to make everybody realize that this is the scenario and we need urgent action on that. When you spoke on obesity, I was again and again looking at Dr. Vidya Tobbe, because nutrition, she has brought nutrition into the center stage during her tenure as the chairman of the Food and Drug Committee of FOGSI. Think nutrition first was the tagline. And today, when we speak of anemia, nutrition anemia. Today, when we speak of obesity, again, nutrition lifestyle. Today, when we speak of GDM, again, it is the nutrition component. So the triple burden of malnutrition, Vidya. The first data that we got from your region, Vijaypur, when your postgraduate did a study on diabetes and reported a far lesser percentage than the rest of Karnataka, we were a little doubtful about the data. But then we looked into the kind of diet that your region has, with the millets being the mainstay, and then good proteins, less carbohydrates, and, fairly a good lifestyle. And therefore, it was not, then we related to the numbers that, it is not surprising that with this kind of a diet, which is ideal and we advise, that's already in their, usual dietary pattern. And there was the beginning of our understanding of how to inculcate eating right in the population, right across the age group. The adolescents are one category with the junk food. Charmila said the women in the rural also get whatever in hand, quick fix, and then they eat, and then, nobody is really thinking about doing the right things. So as the Food and Drug Committee chairman, thinking nutrition first, what has been your endeavors to raise awareness on undernutrition and overnutrition or not eating right, and the burden of macronutrient deficiencies, what we call the triple burden? Vidya.
Thank you, IHW Council, and Hema as usual. Actually, when I took as a chairperson of Food, Drugs and Medical Surgical Equipment Committee, I was really thinking that what I should do with in this committee. So then I had a lot of search studies, and it really, and the Pony initiative, when you called me for that conference, really ignited me that something I should do in this. So everything revolves around nutrition, and we always call balanced nutrition for balanced life. And whenever we talk of our in Hindu culture, we talk Anna Hai Purna Brahma. So Brahma is a creator who creates. So we also talk of Anna, whatever food we eat is a Purna Brahma. So nutrition always is always a basic human need we talk. But whenever we gynecologists, we spend very little time of taking any history, any nutritional counseling, as well as we take less interest in the calorie intake any pregnant woman takes of her social background or family background. We have very less time. So I thought of creating some module or something, and then came this nutritional checklist and FIGO's initiative also as a Think Nutrition. So I feel that the doctor of future will definitely give a nutrition prescription whenever it comes to. And as nutrition revolves, as you told, from adolescent, then comes preconceptional and maternal and postpartum, it revolves. And as it is connected with NCD, as you told, GDM, and it all depends on the carbohydrate intake. And the carbohydrates which are simple or complex, how much glycemic index, this has to be taught to any woman. So the basic energy giving foods, then what are the bodybuilding foods, and what are the micronutrients and macronutrients. These are, our knowledge about this is only deficient, and that has to be, I think, should be taught to our gynecologist and obstetrician, because they also, and all the mothers, and we should always take the social background of the patient whenever we are prescribing this, whatever the nutritional prescription, what I feel.
Yeah, so, you're also toying with the idea of bringing in structured courses and modules to be developed for
ICOG certification course, but those are the lectures. But what I feel is we have to teach all the obstetrician and gynecologist about the nutrition checklist and the prescription of calories and various charts, the protein content or complex carbohydrates, how much the carbohydrate content of each of the food. And there are various NIN charts also which we can give to these women. So these are the various things we can do in this.
Do you think the clinicians, Vidya, do you think the clinicians just push nutrition advice under the carpet and say, oh, what is there to tell about nutrition? What's a big deal? We think about nutrition only when she's got diabetes.
Most neglected part of our whatever, what I feel. I mean, we ourselves also, how much we care of our food. That is all secondary part, but definitely we should think of urbanization and rural population. The things are different. In the rural population, there is undernutrition, and in urbanization, there is overnutrition, and that is what we call it malnutrition. Means they more of their food is pizza, burger, and they eat more in malls. So those things we have to care of. Obesity, obesity and its effects, and the insulin resistance they produce. Then PCOS and obesity is increasing, and the cardiovascular diseases even in the younger generations we think of. Even I have seen some of the patients with psychological problems, mental health problems, because this food, whenever they eat, they release various radicals and oxidative stress, and even cancers. So these are the NCD burden. Everything revolves again on nutrition part. Yes.
So again, we
have to imbibe on the healthy eating, and we have to tell what is healthy eating again. So these are the things that will definitely reduce the risk of developing obesity, osteoporosis, iron deficiency, even dental caries, hypertension. And in their certain countries, they have even brought the ban on the salt intake. Intake, which is getting worse in our various preserved food. They have the salt content more than what is required, and we never take that. So, and
I think, Vidya, when you took over as chairperson of Food and Drug, you said, what will I do here? And then, by the time you finish your term, oh, there is so much more to do.
So much to do. And that now the nutrition has become very favorite part of mine. So wherever
Yes.
I go, I see that some nutrition part comes there.
Yes, and because with so much conviction and with so much passion, you say in all the forums that everybody has got charged up about thinking nutrition first. So thank you so much for your
Hema, I
lovely.
want to add here, you brought that the concept of the plate, the
Yes.
GDM plate. That
Yes.
was a wonderful idea, and I think every consultant should have this plate. One is pregnancy plate, and another is GDM plate. So for explaining the patients that what to eat, how much to eat, that is very useful.
Yeah. I think Surekha wants to say something before I go on to Priyankur. Surekha,
Yeah, I
you
just
had also
wanted
put
to
a
add.
message in the chat about the millets. See, in 2018, the Prime Minister declared this as the National Year for the Millets, and to 2023, it's an International Year of the Millets. There's a
Exactly,
huge
that's what
buzz.
was my point, actually.
Yeah.
And I would like to share a personal experience about millets on this forum. Last 6 months, I was suffering from arthritis. I had suffered a huge accident some 15 years back, and I was having arthritis, which was because of, dating to that accident. And last 6 months, there was a relapse, and I had to take steroids. So, and because of steroids, I had gained a lot of weight, around 10 kgs of weight I had gained, and I had a lot of problems because of that. And then there is a person here, Dr. Sauji, who is propagating the millet diet. And then suddenly, 2 months back, I decided now I don't want to take any steroids, nor these painkillers and all those things. They were going to advise me methotrexate also to take care of the arthritis. And then I listened to a lecture by Dr. Sauji on millet diet and, fruit and vegetables. He has a very nice concoction, very nice created how to reduce the weight depending on, and then he has some red, some green, and some orange, foods. So red food is that which is to be avoided. So in the red food, he has put wheat, your white rice. These are the two things. And of course, sugar and lowered the salt. These 4 things he has put. All these whites are in the red, and also wheat is in red. And what is in the green is the millets. All your millets, your jawar, bajra, ragi. So all these, what we say fasting rice, all these are in the millets, and these are the green. That means you can consume as much as possible. And of course, you should have adequate amount of fruits and vegetables. And what he propagated was the 80-20. So 80% of your diet should be coming from fruits and vegetables, and 20% should be coming from grains. And if you ever want to eat rice, it should be the brown rice. So that means the fiber content has to be increased. And I am very happy to share with you, I started this on 14th of Jan, and today is the 15th of March. 2 months of abstinence from all the wheat, all the white rice, all sugars, coffee, tea, everything is gone. And I have lost 8 kgs of weight in only 8 weeks. So, and I'm so much of a proponent of it. My husband also did it with me, and no oil in the cooking. That was also an additional thing. Dr. Sauji is from Amravati, and we have been doing our, our labs also to find out how the cholesterol has come out, the blood pressure readings have gone down, and the blood sugar levels of those who are diabetes has come down on its own just by following the diet. So I do agree with Vidya Thobi ma'am that nutrition is the core and the key. And with that, of course, moderate amount of exercise. You don't need to do so much exercise. You don't need to go to the gym. You don't need to do that, 10,000 steps and all. You do a moderate amount of exercise and you follow a good diet. And that's what I'm telling, you need to start early. Our adolescents, You
Yeah.
need to start training them. You need
And I
to
think,
inculcate these habits in them. I think
So
that's
that's
very,
what
very
they say, that the doctor of the future will not give any medicine, but they will give the diet prescription and the nutrition prescription. And we have to teach the signal system, not only for the millets, whatever they have. The on the plate there
Yeah.
is red, yellow, and green.
Right.
So we have
Yeah.
to.
So I think this testimonial from yourself, with your own experience, has added much value to our
Yes, yes.
conviction and thinking that think nutrition first, because it's just not in saying, but it's in doing with the disciplined manner in which you have just detailed, that it will make a huge difference. And the pathway to wellness, if I may say, is through the route of nutrition. Um, uh, Before we close, we'll also let Sanjeev ji make some comments. But before that, the end talk on this scenario, Dr. Priyanka Roy, the much popular, as I said, the Generation Next icon of FOGSI, very, very savvy with the social media. So I want to ask you, Priyanka, both the demand side, that is creating an awareness, we need to be in the social media space with the right kind of messages for all age groups, especially the Generation Next, so that they start coming and asking for the HPV vaccine, for example. They will start, demanding from the doctors of what. Would you see such a change of scenario? That's on one hand. On the other side of the coin is to generate awareness amidst the frontline healthcare providers and all cadres of healthcare providers to do the right things, because everybody mentioned about the capacity building. The demand is generated, people come to us, and then we have no clue on, or the service in very variety of setups is really not up to the mark. So what is your thought process as the chair of the Public Awareness Committee of FOGSI? Any thought process, because the kind of TikToks and jingles and animations and the shorter but impactful, which is very difficult to make, the tagline which creates a buzz, they have to remember maybe a Bollywood song, maybe something else. So what is the thought process churning in your mind which you will execute during your tenure for awareness, and what are your action points? Priyanka.
Thank you so much, Hema ma'am, for giving me this opportunity. Thank you, IHW Council, for this opportunity again. So, ma'am, as you have said, as has been said by all the respected faculties who are present in this forum, I think in today's day, one of the most important things that we understood from all the comments as of now has been awareness. I think that is one word that, if we look at, is the word that we need to look forward to, because that is how we will progress to the goal, to the aim that we are looking forward to. The Government of India, FOGSI, and the other organizations like ISAR, IAG, all the organizations that are there, FIGO, of course, are all looking forward to basically creating an impact to the betterment of women's health. But that can only be possible by making them aware that we are doing these activities for their benefit. We do all talk of, I just a couple of days back, I was seeing a sort of, one of the doctors have posted a funny advertisement, I would say. He has put out a cutout in the clinic, in the office outside his clinic, and it says, if you want my opinion, you will have to pay me 500 rupees fees. If you take my opinion and also my diagnosis and treatment to be continued, you will have to pay me whatever 1,500 rupees. But if you get the opinion, if you have made a diagnosis from yourself from Google and want an explanation from me, you will have to pay 10,000 rupees to me. Because probably of the fact that, in today's day, most of the patients read through Google and come. Exactly the question you were asking, ma'am. Most of the questions go through the internet. They, in fact, not only about the disease, they also do a search of the doctor they are going to. They literally will come and tell you, doctor, you have been in so and so places, so that is why we have come to you. So that is how things have gone in today's day.
Priyanka is frozen, I think.
And that's why things have become a lot easier for us to make. Ma'am, you can't hear me?
Yeah, now we can.
Okay. So as you talk of, so ma'am, as you talked of TikTok, Facebook, Instagram, I think is one of the handles that most of the youngsters are now shifting towards. And I think these are easier ways of making you aware. You see this famous ads of people pointing the fingers here and there, a lot of text coming all over. I think those are very short and cute messages to, bring a point forward, and that makes a lot of impact. Again, if you see, you have a lot of your patients in today's day who follow your Facebook page, who follow your Instagram page, and the messages you put forward over there. And also, I do understand this is sometimes maybe a mode or means of advertisement where you try to put in a point so the patient contacts you, comes to you, and you try to make them aware of what exactly is happening. But again, if you look at the broader picture, ma'am, we definitely need to, from the public awareness committee, if you look at the broader picture, what we are doing now, we are trying to use these models to, because we have got a YouTube channel as of now, we've got a Facebook page where we're trying to put a lot of these models and especially targeting the younger generation. As you talked of the cervical cancer vaccination, so one of the important group to target, I would say, are the school students and the college students who will be a primary target of mode of target for this social media pages.
Priyanka, one question in connection with this. The Bahubhasha, the many languages in our country is really a mind-boggling challenge, because if you make just with music, some animations, yeah, it's global, it's open to all. But unless we had that experience in Manyata training, that we have a Kannada batch, a Tamil batch, a Marathi batch, a Hindi batch, because staff cannot understand if we just tell in English anything that contrary to our opinion. So we have a master trainers in all these languages. So with the UI interface, it's not very difficult to do. But what is your thought process on conveying it to them in their own language?
Ma'am, most important, ma'am, I would say conveying to them in their own language is the thing that really brings about that impact. We all know from the days we have started doing our medical schooling that we have been told, take consent in the language that the patient understands. I think that is one line that is the key holding, because once we talk in a language,
yeah, Priyanka, again you're frozen. Maybe if you just close your video, maybe it will be better audible. Yeah. So this is also, the power of technology and the lapses in technology.
Always creates a definitely who probably are not known by their name, but they. I'm so sorry.
Yes, Priyanka.
Am I audible now, ma'am?
Yes.
Yeah. Okay. Yeah. So, ma'am, in today's day, I would say there are a lot of my friends, people of my generation, who probably are not known by their name, but they are known by their Instagram handle name. So that is how in today's day probably people are moving forward to, like, making their memes, their probably their animations more famous than what probably their name would carry forward to. But then, ma'am, the important thing, as you said, I think I would say that in their own language, putting the thing forward, and the most important way of doing it probably is probably some bit of animations, and also those sort of sweet dances to Bollywood tunes, etc., which creates the point and which makes the impact right at the heart and that the patient needs to follow. Again, ma'am, one of the awareness activities we were just reading through it in the state of Arunachal Pradesh here. They were talking of the cervical cancer vaccination, and one of the ways that they have done it is by sending by leaflets from the schools in the tiffin boxes of students. So we all know that when something comes from the school, the mother will definitely pick it up, they will read through it, and they get vaccinated. And Arunachal Pradesh is very well vaccinated. Ma'am, I'm sure she knows it, and she is also proud of the fact that the way Arunachal Pradesh is doing towards this. So, ma'am, I think social media, as you said, leaflets and probably some of the other materials are things to look at for the future, because those are the ways in which we can propagate more and more towards learning of various activities. From the public awareness committee, ma'am, we even are currently doing a project on the anemia, ma'am, that also being one of the important NCDs of the country, and we are doing a project on anemia muktari. So we are trying to test almost 400 women, each society across the country, in the month of March. That is the Women's Day month, and we have as of now crossed almost 1 lakh in the last 14 days. Wow. And this is a initiative that has been supported by Encure, and we really look forward to it. And again, this initiative was well taken forward by the social media, again, because we put a lot of advertisements etc. on the social media, and women came forward for their own testing.
Excellent. So testing is the first step, but we must also link it up to how to, really get them to the pink of health, because, but we have to start somewhere. And I really appreciate the kind of huge efforts that in the next generation leadership of FOGSI is already, making a very, very strong mark. But Priyanka, one last thing I want to ask you. When you want to actually convey the messages to the public, besides a technical talk which we can give it with so much ease, to touch their hearts with the shortest possible but most impactful message is the hardest job. How are you putting your thoughts together? Are there some special people in the group, or have you sourced some professionals to, like an advertorial, to make a tagline and to make it, a punch and an impressive thing? What has been your, the task force, if I may call it? Yes.
Yes, ma'am. So, ma'am, what we are looking forward to is, like, for every day that is coming up, we are doing a competition, because we know Foxians are super talented. We have got our medical forum, the medical gynecology, the sisters, the non-teaching, even in the non-medical practitioners, like non-doctors, I would say, they are also super talented, and they bring out beautiful paintings, beautiful slogans, etc., which are things which are quite impactful. So what we are further doing is, with these slogans, we are trying to bring them forward, and we are getting few of our celebrities who are, putting those messages forward, so that those could be circulated in the social media as well. So I think, ma'am, this poster slogan competitions are something that really have brought in the force. And if you read this competition, it's like amazing. 5 days, and there are almost some 50-60 entries that come in. And few of the very good, we all know that Bara to Bara campaign that was started by one of the pharmaceutical companies. So those are things that really touches the heart, and you remember as well.
So Sanjeev ji, this is Foxy out of the box, the crowdsourcing, the crowdsourcing of the messages. This is superb. Excellent. Thank you so much. Now, before we listen to the Foxy president in dialogue with Mr. Kamal Narayan, I would like Sanjeev ji to throw some light on his concluding comments on all the views and the passion with which my very beloved and distinguished leaders here have presented. So your thoughts, sir.
Thank you. I can go now?
Yes, sir.
All right. Thank you. No, there were a few points which were missed out. One is women play a very important role in medical care at home. And there was a study published and study done by Lancet Commission on Health. And they did costing of how much in terms of money women contribute to medical care. And we feel we are the medical care provider, but the most important medical care provider is women at home. And they came with the figure of 175,000 crore rupees worth of medical care women provide in India to the people who are sick. And we always undervalue, we will tell them to do. They are already doing a lot. What we need to look at is how do we build their capacity. This is only medical care, Hemaji. Yes. They also, if you add the value, how much economic worth they give in keeping people who are healthy in the family, and post-convalescent care and convalescent care, this will be huge amount. And I compared with how much government spends on in 1 year. I gave you the figure of 175,000 crore is the medical care. This is a figure about 12 years old. But I looked at the most recent Government of India data. They spend, both states and central government put together, spend 169,000 crore rupees. So women 12 years back were spending more than what all central government and state government put together are spending. So let's look at them as very important care provider. Men also contribute. They contribute only 1/5. 38,000 crore rupees was the estimate they made. So this is one point we need to. They are providing healthcare. We need to build their capacity to do more in taking care of themselves, and also in taking care of the family.
With the Health Sector Skill Council, Sanjeev ji, with the Health Sector Skill Council, the Arogya Mitra cadre was there during COVID. Taking a cue from that, Swasthya Sakhis is the new program we've started for the community healthcare workers who will get certified by the Healthcare Skill Sector Council, and then they will be the wellness ambassadors. They will be disseminating right messages. They will be doing the care at home. And then already they're adding so much value, as how you have said, but this will be a multiplier effect. So point well taken, Sanjeev.
So you already have a Swasthya Sakhi in every home. So keep that in mind and build their capacity. The second point I wanted to raise is we have huge data available to act. For example, in National Health Agency, PMJY, Pradhan Mantri Jan Arogya Yojana, they have looked at how many women are enrolled. About 60 crore people are enrolled. The women are enrolled 49.6%, almost equal to men.
Yeah.
But when it comes to the claims settled for women, it is 40%. So the point I think raised by one of our panelists, I don't remember who, was that they don't have access to quality care. This is when healthcare is free. We need to look at the data. When they have to pay for healthcare, this figure will further come down. So we have enough data to start working on it. Yes, we can keep refining as more and more data becomes available. Right. One more point which came up is non-pharmaceutical interventions are part of the treatment. We as doctors need to give more emphasis on diet, weight management, physical activity, tobacco and alcohol intake. These are non-pharmaceutical interventions which need more attention than pharmaceutical and surgical interventions we focus on. The last point I want to make it, we have been emphasizing 73% deaths take place because of NCDs. And I mentioned that women live 3 years longer than men. But when it comes to healthy lifespan, it is equal to men. That means they suffer from ill health 3 years more than men. So we need to make sure that we act on what data is available. And the last point is we need to make the health system resilient. We heard painful stories of women delivering on the street, women delivering in the police van because they were denied access to normal delivery care. And just imagine, for NCDs, detection was delayed, their treatment was delayed. If they had complications in hypertension or diabetes, their management was delayed. So we need to, firewall the healthcare system to take care of these needs, COVID or no COVID. Thank you so much. These were the points I wanted.
Thank you, Sanjeev ji, for sparing your valuable time, because you always add value with your mature thoughts, because you've seen it all. How what works, what doesn't work, and a wise advice like this will really strengthen our efforts in putting our time and efforts into the low-hanging fruits where it's needed the most, what is feasible and what is easily doable. So with the point of Shapath, which says act today for a better tomorrow, we carry that message across for the generations to come. And in the closing, my heartfelt thanks to all my champions on the screen here, starting with Sanjeev ji, Dr. Vidya Topi, Priyanka Roy, Surekha ji, and Charmila, who are well into walking the talk, if I may say, because whatever they have said today is all what they have done, and they have enough the resilience, passion to withstand all the challenges, use the opportunity to move ahead to do more and more under the leadership of Dr. Rishikesh Pai and as the president, and Dr. Madhuri Patel as the secretary of FOGSI. So we all join hands to do better than yesterday for a better tomorrow. With that, I would ask Himani and Kamalji to kindly play the video recording of the dialogue that we've had with Dr. Pai, and that would bring this very thoughtful evening to a close, only in order to rethink again on what is the next best thing that each one of us will do, because we do believe that we are better together. With that, namaste and thank you again. Himani and Kamalji.
Yes. We have with us somebody who is very passionately has been pursuing one of the most important agenda for our country, for our society, and for our people, and the agenda of women's health. Somebody who has been leading this cause for many years, but right now, and on this particular year, is leading again the institution called FOGSI, an institution, an apex body of more than 40,000 gynecologists of this country. So welcome, Dr. Pai. You have taken very important lead in FOGSI under your presidency to have the whole focus on the holistic women health. And in holistic health, what has come out really very strongly is that you have a very strong focus on NCD, prevention, care, and management. What has been, the key driver for this, Dr. Pai, and what are the areas you looking, particularly when it comes to managing NCDs in our women?
Thank you, Kamalji and Hema ji, for inviting me on this show. And I would like to say that when I took over as president, I had this presidential, we had to have a campaign. So this time I had a campaign, it was called Change. In Hindi, it is called Badlav. And it was defined by 3 words, that is integration or ekikaran, then samanta or equity, and the third part was technology, utilizing technology to bring about integration and equity. And so if you look at India, of course, everything is binomial. So you have got rich and poor, you have got women and men. So similarly, you have got pregnant and non-pregnant. So I divide it into 2 parts, the pregnant and non-pregnant. So as far as I am concerned, the health of the nation is assessed by the mortality. Of course, morbidity is also very important, but our prime thought process was, when we got independence, was to bring the mortality down. Now, as the maternal mortality contribution due to pregnancy starts sliding down, we start focusing on the other part, and that is the non-pregnant morbidity and mortality. So suddenly cancer cervix starts coming up, diabetes starts coming up, hypertension starts coming up. So when our first thing was survival, so we brought the survival down, and we are right on track. And that's where the NCD is coming. So NCDs obviously contribute to mortality. Cancer cervix is a big issue and it contributes to mortality. But it's more of morbidity, quality of life, which is important in the NCD area. And that's where I think that the focus should. So it has to be both. We must keep on. We should not lose our track.
Thank you so much, Dr. Pai. The most interesting aspect of your all the work and the scenario is defined is that bringing that badlav and the kind of change of perception and change of approach when we are kind of approaching women's health and looking at the women's health. And as you very rightly said, that we can't kind of lose our sight or our aim at the reducing the maternal mortality rate, and where India has done remarkably well over the years. Let me just bring in Dr. Hema Divakar also on this conversation. And Dr. Hema Divakar, you both are, I think, the most powerful duo when it comes to influencing and implementing women's health, and kind of bringing what is needed for the time for this particular space. Dr. Pai, the way he has kind of described that how we want to under the Badlav Clinic and the whole thought about of FOGSI on bringing integration, bringing equality, reducing disparities, and taking a holistic approach on women's health. You have been appointed as the head of and the chair of the NCD committee of FOGSI. So first of all, congratulations for that. And what I see, your task seems to be very well carved out from the very beginning, the way Dr. Pai has, described this. How do you see, you have been very actively involved in this space of women thought from FIGO as well. And now being the chair of the NCD committee of FOGSI, you have an important task in front of you to bring this whole, kind of attitudinal change of looking at women health in totality, while not losing the sight of something which is very critical, but at the same time reducing another emerging massive burden of mortality on women. How is this going to, kind of take place, Dr. Hema?
Namaskar. Thank you again, Kamalji. And you said the powerful duo is here between Dr. Rishikesh Pai and myself. And the buzzword in the country today is the double engine. So I think we are well aligned with each other for a decade on the quality initiative of Manyata, where we have, as 2 parallel tracks of technical and administration, run a long path And that is our shapath, or the resolve, that we are not going to, give up, and we will do whatever it takes. So this whole series, the idea that Dr. Pai has pitched, we wanted to go along the lines of awareness to action. Because 10 years ago, the word NCD, when I mentioned in a gynecological forum, and asked them just to expand what is NCD. Many said, oh, it may be National Commission for something, it may be National Council, or even the thought that it is non-communicable diseases, that buzz and sensitization we began a decade ago, and now the awareness on all the factors that Dr. Pai mentioned is slowly gaining the center stage, because indeed for women's health, the mortality, morbidity beyond pregnancy, why are we saving these mothers in the first place? Just to get them into these bracket of NCDs and have a struggle in the rest of their tenure of life. And we say no. Today, we are dealing with a tsunami of NCD, and it is our shapath or resolve again to have a handle on it. So first thing is the awareness, because everybody, even in the community, should know that pregnancy complications such as diabetes and hypertension today will lead to NCD tomorrow. So that link, that awareness, the awareness of HPV vaccine, if they miss the bus, they may get cancer cervix. So this link of this awareness has to be brought out, and then we move on to the action points, because it's no use thinking and talking and making a problem statement. We have to offer very out of the box solution of implementation, like how we stood as an example to the world about how the COVID vaccination was implemented. So if we work our strategic ways around, we will reach every girl, every woman, we will reach the last mile in the action point. For that, I'm really, really grateful to both our parent organization, FOGSI, and the international organization, FIGO, and the capacity building that we are doing through Artist, and the advocacy we are doing to IHW Council, all the stakeholders coming together with the common purpose of awareness to action. And you will see a lot of action as we go along. Rome cannot be built in one day. It will take time. We are mature enough and aware of the fact that we have a long path to walk. And once again, I repeat that we will do whatever it takes, because we always believe that we are better together, and women's health is indeed nation's wealth. So we are all set for action, especially in the post of whatever the framework which has been assigned by our beloved President, Dr. Pai. We will work our way together to lead on to an impactful implementation of the integrated thought process and bring in the badlav for sure.
Thank you, and congratulations, Dr. Hema, and best of luck for kind of taking up this very, very important challenge and task which is in front of you. And in this whole change of from this itself is a great badlav if we see from awareness to action, and that's what you and Dr. Pai and the whole FOGSI team is aiming for. Dr. Pai, when it comes to NCDs, is we in IHW Council also believe that while we have to have a very strong focus on maternal mortality rate and those kind of important indicators, NCDs is taking a much bigger toll, as Dr. Hema also said, and you also highlighted. We are seeing that almost 65% of the deaths happening in our country because of NCDs and kind of diseases which comes under it are because of NCD, and in that also women's have a very, very big proportion when we look at it. How FOGSI will kind of enable our healthcare system using your massive force of 40,000 plus gynecologists led by as I said, the double engine, as Dr. Hema has mentioned. How do you see this big force kind of making this happen when it comes to whether it is HPV vaccination and universal kind of vaccination for HPV, or whether it is, addressing and eradicating things like anemia, which are, like kind of leading to multiple other NCDs, and even diabetes, or we can, kind of win over multiple cancers, and especially cervical cancer or breast cancer, just by vaccination in cervical cancer, or in early detection or screening in the breast cancer. How do you see that whole power getting unleashed under your leadership?
I have realized is that our country is a curative-based country. It doesn't do prevention. Today I was in Uttar Pradesh for their discussion, and I said the same thing, that people will not come to you. So we already have a lot of infrastructure. We have the private hospital, the public hospital, the district hospital, the corporate hospital, the small maternity home. But people will come to you only when they are dying, or they are in severe pain or distress, or they are bleeding a lot. So their whole psyche is based on curative psyche. They're preventive, they don't come. I was telling them my mother's story. My, her family, there are 5 doctors, but she never, in her 87 years of lifespan, she never had a pap smear in her life. So the story is not of availability of a health infrastructure, but the story is how to get the people to utilize it. To give you an example, the Federation has had a cancer screening camp. So we did 62 societies came together just on the 4th of February. And they did, for 5 days, they did a cancer screening camp where they did 4,200 patients. And we picked up 10% abnormalities in cervical cancer on visual examination of cervix, and 3% abnormalities in by breast examination. We could pick up breast lumps. But you would be surprised that majority of the patients had come for the first time. So the problem is there. They don't come. So we will have to go after them. So we'll have to do outreach. So there's a lot of dormant disease in the population, which we are not aware of. If they don't come to you, how do you know? So we will have to be aggressive. We'll have to go after them. So that's the only way. So one of the ways is that we keep on having. So what I learned from this camp was, the other thing I learned is we don't need funding. My submission is that by the Federation, we are making a change. We are creating a badlav. We are making our Federation members understand that data entry is important. We are making them understand that going after the people is very important. And the third thing is creating more awareness.
Dr. Pai, you have, very aptly highlighted the importance of data when it comes to dealing with large public health issues, because that's where you bring credibility, that's where you bring that insight to where to act and when to act, and whether we are really getting or as Dr. Hema said, missing our bus in terms of when it comes to action. And that's why I believe this whole the thought about from awareness to action can happen only when we have a very strong database, which can not only awaken policymakers, but can also awaken people to kind of act for their health. Thank you so much, Dr. Pai, for sparing your time from your very busy schedule. And I'm sure a lot of these engagements are going to continue, because what is important is to bring that consistency and the continuous focus towards bringing and keeping that in mind. What Dr. Hema very aptly says is that women's health is the nation's wealth, and we all need to work towards that and ensure that we are contributing so that they contribute for the growth and prosperity as well as happiness of our nation. Thank you so much, Dr. Pai.
When we say we'll do whatever it takes to catch Dr. Rishikesh Pai, the president of FOGSI, wherever he is, the technology has helped us so much that we got him in the middle of the night to tape this dialogue and hear his presenting his thoughts and his vision. If I can just ask Himani to just flash a slide from our Secretary General of FOGSI, Dr. Madhuri Patel. she has sent in a message because she couldn't join us today, nor she was available at any point of time for recording. Yes. So this is Dr. Madhuri Patel. Incidentally, she's the first female Secretary General of this great organization, because it's a very tough job for a tenure of 3 years. Dr. Madhuri says, FOGSI, the organization with committed leaders and enthusiastic members, lend us a lot of strength to translate our vision into action. As the Secretary General of FOGSI, I'm witnessing the continuum of action to reach out to every girl, every woman, everywhere. NCD Awareness to Action is one such initiative which will give the gift of good health and wellness to the generation next. I wish the very best for the success of the new series of activities that would make an impact. And she says, thank you for having me here. All the FOGSI leadership is always so supportive that it inspires us to do more, and it inspires us to continue to do things forever and ever. And as we have again and again emphasized, that the change will come. And as Mahatma Gandhi said, be the change that you want to see. So each one of us here who have participated in this forum are huge change makers in the society, because the hardest thing is to change yourself, though it's the easiest thing to expect changes to happen in other people. So with that, with yet again a resolve to do the best that we can, on behalf of Mr. Kamal Narayan, the CEO of IHW Council, on behalf of myself and Team Artists, and on behalf of Dr. Rishikesh Pai, Madhuri Patel, and all my very beloved champions, we wish ourselves a great innings ahead to see the nation in the pink of health, free from NCDs. Thank you very, very much. Namaskar.